Did you know that certain itchy zones on your skin could be an alarming sign of your overall health? As we age, our skin becomes more sensitive and prone to conditions, but did you know that persistent itching could signal deeper health issues that might shorten your lifespan? Introduction. For seniors, skin health isn't just about vanity or comfort, sometimes it's a crucial sign of how our body is functioning. In this video, you will learn how specific itchy zones could be a signal from your body, and how addressing them can lead to a healthier, longer life. If you have been experiencing persistent itching, or if you know a senior who has, the tips you will learn here today could make all the difference. So, stick with me till the end to ensure you don't miss vital advice. Point 1. The itchy scalp signal. An itchy scalp in seniors might seem like a trivial nuisance at first glance, but it can actually be a harbinger of more serious health issues. This symptom, especially when persistent and severe, warrants closer examination because of its potential linkage to systemic conditions like scalp psoriasis. Scalp psoriasis is not just a skin disorder. Research indicates it's an inflammatory condition that can point to increased risks of cardiovascular diseases, including stroke and heart attack. The inflammation associated with psoriasis is believed to accelerate the formation of plaque in blood vessels, leading to atherosclerosis. A study published in the American Journal of Epidemiology found that individuals with severe psoriasis are 44% more likely to develop coronary artery disease compared to those without psoriasis. This is particularly concerning for seniors, who may already be at a higher risk for cardiovascular problems due to age-related changes in the body. The scalp, rich in blood vessels and nerve endings, can become a critical area for indicating such systemic issues through symptoms like itching and flaking. Consider the story of John, a 68-year-old retiree who experienced persistent scalp itchiness and dismissed it as a minor irritation. After several months of using over-the-counter shampoos and remedies with no relief, he finally consulted his doctor. A careful examination and subsequent tests revealed the presence of moderate psoriasis, which had been exacerbating his already elevated risk factors for cardiovascular disease. This led to a timely intervention focusing not only on treating his scalp condition but also on managing his heart health more aggressively. John's case underscores the importance of not overlooking what might initially appear to be a benign itchy scalp. It serves as a reminder to seniors and caregivers alike to seek medical advice when experiencing such symptoms, as they could be indicative of larger, more threatening health issues. Engaging with these symptoms proactively can lead to better overall management of one's health, potentially staving off more severe complications and improving quality of life in one's later years. This holistic approach to seemingly minor symptoms can be crucial for maintaining heart health and overall well-being in the elderly population. Point 2. The mystery of itchy lower legs. Itchy lower legs might initially seem like a trivial annoyance common among seniors, but they could be signaling something much more significant, such as poor circulation, which is often associated with diabetes or peripheral artery disease, PAD. This symptom can be a clinical indicator of vascular health issues that, if ignored, have the potential to lead to severe complications including limb loss or cardiovascular events. Diabetes, for example, causes microvascular changes that diminish blood flow to the extremities, leading to neuropathy and skin irritation. Similarly, PAD involves the narrowing of peripheral arteries due to atherosclerosis, reducing blood supply and causing the legs to itch, hurt, or even change color. A scientific study published in the Journal of Diabetes Research indicates that up to 33% of diabetics suffer from skin conditions, with itchy skin being a common complaint. The research points out that the itch can be directly related to poor glucose control, which impairs blood flow and nerve function in the legs. Another concerning aspect is that seniors may not feel pain due to neuropathy, hence itchiness might be one of the few warning signs that they can experience. Take the case of Martha, a 72-year-old with a history of type 2 diabetes. Martha noticed persistent itchiness on her lower legs but initially attributed it to dry skin, a common issue in her community's arid climate. However, when she mentioned this during a routine checkup, her doctor performed further tests. It turned out that her blood sugar levels had been poorly controlled for months, exacerbating her circulation problems. This discovery led to a change in her diabetes management plan and introduced new medications to improve her blood circulation. Martha's story highlights why it is crucial for seniors experiencing itchy lower legs, especially those with a history of diabetes or potential for PAD, to seek medical evaluation. Addressing these symptoms promptly can not only provide relief but also prevent serious health complications. It's a vivid reminder that seemingly minor signs should not be overlooked, as they can be crucial indicators of underlying health issues that are entirely manageable with early detection and appropriate treatment. Engaging with healthcare providers about any persistent skin irritation can lead to interventions that significantly improve health outcomes and maintain mobility and independence in senior years. Point 3. Itchy, flaky skin. More than just dryness. Extremely dry, itchy skin in seniors can be more than just a result of environmental factors or aging skin. It might be an indicator of more serious underlying health conditions such as kidney disease or thyroid problems. Both of these conditions are particularly concerning in the elderly, as they often progress silently and can have significant impacts on overall health if left unaddressed. Kidney disease can lead to a buildup of toxins and impurities in the blood because the kidneys are less efficient at filtering and eliminating waste. This buildup can cause severe itching, especially on the back or arms, but it can affect the entire body. Moreover, thyroid disorders, particularly hypothyroidism, which is common in older adults, can also manifest as dry, itchy skin. This is due to the thyroid's role in regulating metabolism and energy production, including the health of skin cells. A study from the National Kidney Foundation highlights that over 40% of seniors with advanced kidney disease experience some form of pruritus, chronic severe itching. Similarly, research in the Journal of Clinical Endocrinology and Metabolism shows that hypothyroidism, which affects up to 10% of older women and 6% of older men, often leads to changes in the skin's texture and appearance, including dryness and itching. Consider Helen, a 65-year-old woman who experienced persistent, severe itching that no amount of moisturizing would relieve. Initially, she and her doctor attributed it to dry winter air and aging, but as her symptoms persisted, further tests were conducted. These revealed that her thyroid hormone levels were abnormally low, a condition that was impacting not just her skin but also her energy levels and metabolic health. Treatment with thyroid hormone replacement significantly alleviated her symptoms, restoring her skin's moisture and relieving the itch. Helen's case serves as a crucial reminder for seniors and their caregivers not to dismiss persistent skin symptoms as mere signs of aging. Instead, such symptoms should prompt a thorough medical evaluation to rule out or confirm underlying conditions like kidney or thyroid disease. Early detection and treatment of these issues can dramatically improve quality of life, alleviate uncomfortable symptoms, and prevent more serious health complications associated with these conditions. Point 4. Itching around joints. Persistent itching around the joints in seniors can often be overlooked as a minor discomfort, yet it may indicate more serious autoimmune conditions such as rheumatoid arthritis, RA, or psoriatic arthritis. Both conditions involve the immune system mistakenly attacking the body's own tissues, leading to inflammation that primarily affects the joints but can also manifest in the skin and other organs. Rheumatoid arthritis is known for causing painful swelling and deformation in the joints, but before these more visible symptoms appear, subtler signs like joint itchiness and skin redness can occur. Psoriatic arthritis often comes with psoriasis, which includes skin symptoms like itching and flaking that can precede or accompany joint issues. According to the Arthritis Foundation, about 30% of people with psoriasis will develop psoriatic arthritis, and early signs such as joint itchiness and tenderness can be crucial indicators for seeking medical evaluation. Consider the case of Robert, a 70-year-old retired carpenter who began experiencing mild itching around his knees and elbows. At first, he assumed it was due to his years of physical labor. However, when the itching became accompanied by joint stiffness in the mornings, he consulted his doctor. A thorough examination and subsequent tests confirmed early-stage psoriatic arthritis. This diagnosis came as a surprise since Robert had only minor psoriasis on his scalp, which he had managed with medicated shampoos and never thought much about it. Robert's diagnosis led to early intervention with disease-modifying anti-rheumatic drugs, MARDs, and lifestyle adjustments, which significantly controlled the progression of his symptoms and maintained his joint function. This proactive approach highlighted the importance of not dismissing early, seemingly minor symptoms like joint itchiness, especially in seniors who may attribute such symptoms to aging rather than the onset of a systemic condition. Robert's experience underscores the critical nature of recognizing and addressing early symptoms of conditions like rheumatoid and psoriatic arthritis in seniors. By doing so, it is possible to prevent or minimize the progression of these diseases, thereby preserving joint health, mobility, and overall quality of life. This proactive health management is vital for maintaining independence and well-being in later years. Point 5. Abdominal itching, a hidden warning. Abdominal itching in seniors might seem like a minor symptom, but it can sometimes signal serious underlying health conditions, such as liver diseases including cirrhosis or hepatitis. This type of itching occurs because liver conditions can lead to the accumulation of bile salts and other substances in the bloodstream, which then deposit in the skin, causing irritation and itchiness. Particularly concerning is when abdominal itching is accompanied by other symptoms such as jaundice, a yellowing of the skin and eyes, as this combination strongly suggests liver dysfunction. The liver plays a critical role in processing and eliminating toxins from the body, and any impairment to its function can have widespread health impacts. According to research published in the World Journal of Gastroenterology, pruritus, itching, is a common symptom of chronic liver diseases and can often precede other more overt signs of liver damage. Early detection and management of liver issues can significantly affect outcomes, as liver damage is often irreversible if not addressed promptly. Take, for example, the case of Linda, a 68-year-old who initially noticed mild but persistent itching around her abdomen. She didn't think much of it at first, attributing it to a new laundry detergent. However, when she started noticing a slight yellow tinge to her skin and eyes, she visited her doctor, who conducted liver function tests. The tests revealed significant liver impairment due to undiagnosed hepatitis C, a condition she might have contracted decades ago. Prompt treatment with antiviral drugs was initiated, which helped manage her symptoms and prevent further liver damage. Linda's case highlights the importance of not ignoring symptoms like abdominal itching, especially when they present with other unusual signs. For seniors, recognizing these indicators and seeking early medical evaluation is crucial, as early treatment can prevent serious complications such as cirrhosis or liver failure. This proactive approach to health can help maintain a high quality of life and reduce the risk of severe outcomes associated with liver diseases. In conclusion, persistent itching in certain zones can be more than just an irritation, it could be an indicator of underlying health issues. If you or someone you know is dealing with unexplained itching, it's important not to ignore it. Early diagnosis and intervention can significantly improve the quality of life and even extend life expectancy. Don't take your skin health for granted. Stay aware, take action, and always prioritize your health. If you found this video helpful, make sure to share it with others who might benefit from this information. Have you or someone you know experienced any of these itchy zones? Let us know in the comments below. Stay connected and keep your health on track. Remember, your body communicates in many ways, itching is just one of them. Take care of it, and it will take care of you.